Medicaid has a significant impact on rural communities in Arkansas, as it does in many rural areas across the United States. Here are some key ways in which Medicaid affects these communities. #1. Access to health care, primary care. Medicaid provides essential access to primary care services for may be scarce. Specialist services. It also facilitates access to specialist care, which might otherwise be unavailable in rural settings. #2. Economic impact. Healthcare jobs. Medicaid funding supports healthcare jobs in rural areas, including positions in hospitals, clinics, and nursing homes. This can be a significant source of employment in communities with limited job opportunities. Hospital revenue. Rural hospitals often rely heavily on Medicaid reimbursements. Without Medicaid, many rural hospitals would struggle to remain operational, potentially leading to closures and further reducing access to care. #3. Public health preventive services. Medicaid covers preventive services such as vaccinations, screenings, and wellness visits, which help improve overall public health outcomes in rural communities. Chronic disease management. It supports the management of chronic diseases, which are prevalent in rural populations, through regular medical care and medication coverage. #4. Vulnerable populations. Children and elderly. Medicaid provides critical support for vulnerable populations, including children, the elderly, and people with disabilities, who make up a significant portion of rural communities. Maternal health. It also plays a vital role in supporting maternal and infant health, covering prenatal and postnatal care, which is essential for the well-being of mothers and babies. #5. Mental health services. Access to care. Medicaid helps bridge the gap in mental health services, which are often limited in rural areas. It covers mental health treatments and supports the integration of mental health services into primary care. #challenges and considerations. Provider shortages. Despite Medicaid's benefits, rural areas often face shortages of healthcare providers, which can limit the effectiveness of the program. Transportation. Access to healthcare services can be hindered by transportation issues, as rural residents may need to travel long distances to reach providers. Policy changes. Changes in Medicaid policy at the state or federal level can have disproportionate effects on rural communities, potentially impacting access to care and the financial stability of rural healthcare providers. #conclusion. Medicaid is a lifeline for many rural communities in Arkansas, providing essential healthcare services, supporting local economies, and improving public health outcomes. However, the program's effectiveness can be influenced by broader systemic challenges, such as provider shortages and transportation barriers. Continued support and targeted policies are necessary to ensure that Medicaid meets the unique needs of rural populations.